as much brevity as you can. We do want to hear your story. Thank you.
Good afternoon, representatives. Thank you for your open hearts and your time. My name is Dr. Evelyn Griffin. I am a board-certified OBGYN. I've worked in Baton Rouge for almost 20 years. I'd first like to thank Doctors Abraham and Coleman and other healthcare providers that stepped forward with their honest and courageous testimony, and Mrs. Burke for her bravery despite injury and adversity. After my LSU New Orleans OBGYN training, I took a job at a large multi-specialty organization in Baton Rouge. I worked there for 15 years. I worked through the pandemic until I was put on administrative leave in December 2021. I'd like to give testimony about what a typical physician experienced during the pandemic, and perhaps my testimony can add to the answer to your question, specifically, Rep. Galley, as to why more doctors were not speaking out nor doing early treatment. After that, I'd like to present some actionable items for potential legislation. So during the pandemic, the organization did several things that they did well. There was constant communication regarding COVID protocols for quarantine, testing, later for in-house treatment and vaccines. Sometimes we were messaged several policy changes in one day. There were Zoom meetings created to summarize this information with Q&A option. Unfortunately, dissenting questions were often not addressed. When vaccines were made available, physicians in my institution were made aware of VSafe reporting and VAERS, which is the Vaccine Adverse Event Reporting System, at the bottom of an email. There was, however, no follow-up or training or review of these findings or any requirement to follow up on patients after the receipt of the vaccine. Other things that were perhaps not done so well. There was no messaging to the providers regarding counseling their patients on everyday things they can do to improve their immune system, like exercise, better nutrition, fresh air, sunshine. There was no messaging or incentive to tighten up control of diabetics. In fact, in the middle of the pandemic, there was even a system-wide protocol change to stop vitamin D testing. Vitamin D is actually acts as a hormone, a very important anti-inflammatory hormone in our body. This is even despite studies showing that COVID mortality rates were close to zero at vitamin D blood levels under 50 nanograms per milliliter. There was no messaging about recommending early treatment of patients for any kind of early symptom, such as mild illness, whether it be cold, flu, or COVID. It was like all the other illnesses had gone away and there was complete fear of only COVID. Patients were literally told to stay at home if they had early symptoms of any kind, and only to come in if they had significant shortness of breath. It is true, Representative Egan, that some nurses were, for lack of better guidance, would at times tell patients, well, yes, if you're turning blue, you can go ahead and come in. Yesterday, it was mentioned that we do not want to politicize medicine. I agree, so it behooves me that the medication hydroxychloroquine, or HCQ, that Dr. Abraham mentioned this morning, also known as Plaquenil, was politicized because a certain president took it when he had COVID. Hydroxychloroquine is a potent anti-inflammatory drug that we give for lupus. In fact, we continue pregnant patients during the entire duration of their pregnancy on HCQ if they have lupus, even with other medications such as azithromycin. So this is the politicization of medicine that is harmful. Politics that gets in the way of the patient-doctor relationship when we could be prescribing medication that is actually safe and effective even in pregnant patients. Regarding pregnant patients and the vaccines, as with other patients, there was no true informed consent that I had witnessed. Informed consent consists of risk, benefits, alternatives for the proposed treatment. Instead, the only perceived benefit of safe and effective was messaged for providers to discuss with their patients in the choreographed language that Dr. Groh had shared with you all. In that, by the way, she mentioned how this came to her was through a LSBME email. This is what I'm referring to that you all had seen earlier. Through an LSBME email, and the content is Louisiana Department of Health letter attached with the link to the choreographed discussion. If the patient said no, this was to be documented, but it was recommended that the patient be asked again at every subsequent visit. Pregnant employees that dissented were sent to the principal's office, and by that I mean they were to meet with their manager, then follow an instructional video that discussed safe and effective. Then they had to meet with the head of maternal fetal medicine department. After all this pressure, if they still said no, a few asked to speak with me, and mind you, 2 of them I didn't even know. They stated that they would like to speak with me because they heard that I may give a balanced, genuine discussion of risks versus benefit. And these are their words and not mine. Now, people ask me all the time if I noticed any significant changes in our patient population with either COVID infection or with the vaccine rollout. And I will say overall that our group dealt with very high-risk obstetric patients, but I did have a subjective observation of a large increase after the vaccine rollout, that is, in preeclampsia, which is a high blood pressure condition in pregnancy. And quite alarming, there also was a rise in premature rupture of membranes, which is the water bag breaking, and then the baby delivering prematurely, as well as a rise in IUFD, intrauterine fetal demise, or stillbirth. It seemed there were more irregular periods and even postmenopausal women getting vaginal bleeding after receiving the vaccine. I even had a patient perfectly healthy and slim in her early 40s that suddenly developed uterine cancer. The oncologist even said he never saw a clinical scenario in such a patient. Now, I do not mean to harp on the vaccine. I'm a huge proponent of patient autonomy. If you want the vaccine, you should get informed consent, and then if you would like to go on and get it, you should be able to do so. However, I did not support mandates. So my discussion here regarding vaccine is more of a discussion on how they were used to strip citizens of their bodily autonomy and civil rights. So speaking about my subjective observations, about my patient healthcare changes or health changes, that really means nothing unless it's measured. So I proposed we use our electronic medical record called EPIC, the EPIC system, to study these correlations with patient COVID infection and vaccine status. My request was denied. One of the advertised benefits of an electronic medical record as sophisticated as EPIC was to be able to do just this, to easily access the data to study our patients and identify such signals. My observation of these concerning signals was dismissed, and I was told I was not, quote unquote, trusting the experts. I offered to host a journal club that myself and several other providers wanted to start to review worldwide data and research on COVID, including disease pathogenesis and treatment approaches. I was denied repeatedly and was told that, again, I was not trusting our experts, that I was going to cause vaccine hesitancy and therefore would cause people to die. I was likewise asked, like Dr. Grimbrovich, that I not forward any of this information to my colleagues in institutional email. This even included CDC's data, their own data from April 2021, their review of the VAERS report of myocarditis cases that showed a signal of concern for vaccine for young males and the development of myocarditis. Despite this, I was shut down. So you can see that how can the public ask questions if we as physicians were not allowed? Of course, I voiced my concern about vaccinating women with injections that had no studies in pregnancy. In fact, the Pfizer trial data that was submitted to the FDA for EUA approval excluded pregnant participants. Especially in the field of OBGYN, we have a history that warrants significant caution. Many of you all may remember, and I've testified about this before, thalidomide and DES, diethylstilbestrol, both medications that were deemed safe and effective for decades. Tragically, later, thalidomide babies were born with no limbs. DES caused patients' granddaughters to get female cancers. In my office, I had pregnant patients who had pregnant employees who had a looming vaccine mandate. Exemptions were not yet being approved. They came into my office crying because they were torn between taking something with unknown risk and possibly hurting their baby, or declining the vaccine and getting fired and not being able to support their family. Some of these were nurses that worked the pandemic with no proper PPE early on, had gotten COVID, had blood levels to show natural immunity that was then discounted, then were told that they could no longer treat patients and were threatened with being fired if they did not vaccinate. They literally went from hero to zero. And we wonder why there is a healthcare shortage now. Representative Edmonston, thank you for bringing that up. Again, not harping on the vaccine or its safety or effectiveness, just demonstrating how it was used as a tool to strip liberties. Freudian slip. So regarding the employees and COVID vaccination, there was no notification of the options for exemption. Instead, administrators discussed denying exemptions, or at least waiting it out in hopes that Governor Edwards would abolish exemptions altogether. Then one day, the organization suddenly switched gears and approved all the exemptions overnight. I went into the administrative office and asked what the reason, and administrators told me, due to nursing shortages. Not due to any ethical or considerations or ethical or healthcare considerations. For employees that didn't want to get vaccinated, they were given plenty of chances to change their minds. They also had to meet with their manager. They had an instructional video. If they dissented, some of them were visited by one of the highest ranking administrators, and I witnessed, cornered in the hallway and asked how they could be so selfish not to get vaccinated. Administrators talked about withholding care from the unvaccinated. Administrators talked about putting a big scarlet letter on unvaccinated employees. Final decision, however, was to instead give the vaccinated a green badge, whereas the unvaccinated were not given one. Even after it was determined that the vaccine didn't prevent transmission and natural immunity was to be recognized. In this way, their medical information was exposed. This was a HIPAA violation. And with respect to patient reporting, it was advertised by the organization that we had pediatric patients dying of COVID. I was unaware of this, and so I visited the COVID ward, the ICU, only to find that there was one patient they were referring to, and this was a 19-year-old, 350-pound male with diabetes. So hardly a pediatric patient. Now, what I mentioned here is not to throw my former organization under a bus, but rather to paint the picture of some things that you may see written on paper or put on a billboard, but how it actually occurs in reality. I am purposefully not mentioning the organization I worked for because it happens in several organizations across the state. So it is immaterial who it is. It is important, though, however, Representative Owen, I like the idea of inviting back or subpoenaing CEOs of hospitals to come and answer these questions. I will say, though, there was one large multi-specialty hospital in Baton Rouge that did not make vaccination a condition of employment, and they are doing very well. Finally, when LDH slipped the COVID vaccine into the recommended childhood vaccine schedule, I testified against it in December 2021. A few days later, I was placed on academic leave, despite otherwise having a clean record and being nominated for Doctor of the Year for the system. I had also no clause on this academic leave, and I had a 2-year non-compete clause, so could not work within the geographic area. My husband, Dr. Joe Griffin, almost lost his job due to his exemption at first not being accepted. We considered retiring medicine altogether or leaving to a more friendly state to work. Either way, this is how the state of Louisiana again loses healthcare providers. So, actionable items. First of all, I would request for whistleblower protections. For every one of us that speak out, there are many who will not for fear of retribution, many that are not here. To truly learn what has happened from the boots on the ground, there need to be whistleblower protections put in place. LSBME may not revoke our licenses, but our employers may certainly fire us with, again, no cause. Next, legislative process here needs improvement. With all due respect, there are doctors and healthcare providers that cancel patients to come here to give expert testimony to help you all make decisions for the citizens of our state, only to find out that we've run out of time and then they can't come back the next day. And this literally happened yesterday, unfortunately. Next, regarding any healthcare institution, I'd recommend legislation that requires transparency about what data is being used to formulate protocols and policies, encouraging open sharing of research, prohibiting repetitive questioning of employees once they express dissent for a vaccine or medication, and to provide and allow for lawful exemption. Also, legislation to provide labeling employees as to their vaccination status. Anything short of that is a HIPAA violation. Regarding LDH, the recent creation of a Surgeon General position is a step definitely in the right direction. And to second Dr. Hansen's idea of developing an advisory panel, I completely agree. Actively practicing or recently retired Louisiana healthcare providers that would advise the Surgeon General is a great idea. They could be used to crowdsource information, research from around the world that is tough for one person to do, and to give back feedback on results from the trenches. I propose that all LDH communications regarding vaccinations be accompanied by notification of an option for exemption, as was done recently in a bill put into law thanks to Representative Edmondson in our education sector, with an eventual replacement of exemptions with an enforced law that allows for right to refuse. With any health announcement, LDH should always start with information that what the populace can do to support the natural immune system. I recommend for any new or EUA product, LDH develop a statewide program that requires healthcare providers to enroll patients in a monitoring program and follow up on these patients. And finally, this is more of a personal request. I feel like what is happening here is an information war. This is a personal request that with the improved LDH leadership, that with earnest information that was presented here the last 2 days, that perhaps the information be disseminated in novel ways. And, I assume we're all doing this for our children and the next generations. And quite frankly, we really need to meet them where they are. And unfortunately, they're on social media. And I'm sure Dr. Grove is going to hate for me to say this, but I don't want to incentivize more screen time, but getting through to them through shorts on Instagram, YouTube, what have you, we need to be able to share the information and hopefully get the youth to understand that there's a whole different world of information that perhaps they can go back to trusting their own inner voice, their own immune system. And we may have to start through social media in that way. So that's a personal request of mine. And of course, those sources would need to be free of financial funding, special funding, or incentives. And with this, I close. Thank you, ladies and gentlemen.